news everywhere.
The truth of the matter is the problem that we're having is that we are limiting healthcare resources at its finest, and it's becoming extremely dangerous.
Thousands of healthcare workers are absent from the system due to COVID, summer vacation time, and many are burnt out, having left the field altogether. Some hospital ERs in the province have had to temporarily suspend their services, and it poses a real problem for those dependent on the health system. But as it continues, it's also impacting external companies who work alongside hospitals to provide healthcare services to those that need it, like essential blood tests.
Our government needs to provide much more support with our healthcare system. On now, it's no longer just a nursing or just a PAB. This is now all over the hospital. Everybody is burnt out, and now it's trickling all the way up to the laboratories, management. This is a nonstop shop of deficits of staff.
Melanie Jade-Boulerice is the CEO of Nomadic Nurse Agency, a company that provides a multitude of nursing services for clients at home or at pharmacies. She partners with government laboratories for blood test services, something she says has been halted due to the lack of staff.
Companies like mine help alleviate the system and support the system, not compete against the system. When you cut off that resource of the laboratory, you are cutting off that resource of the external services to help alleviate that pressure on the central laboratories.
With laboratories not accepting external samples, Melanie has had to cancel all future blood test appointments, totaling 8,000 to 10,000 blood tests monthly, resulting in losing 80% of business. But she says the ramifications of this will create a larger barrier in getting health care, forcing those in need of services to wait far longer for appointments or pay extra at private clinics.
They're not going to have $300, $400, $500 to dish out at one point. So this is where we're going to see a big problem. Well, we're not only going to see a financial crisis, we're going to see a very big spike in healthcare crisis if we haven't seen one already.
For Melanie, if external healthcare services are not able to alleviate the stressors on central services, it will lead to a larger problem, one that depends on the Quebec government providing more support to the healthcare system. City News contacted the Quebec Health Ministry. In a statement, they say laboratories can accept samples but are not obliged to do so, adding that the shortage of labor in laboratories is such that it is possible that some establishments will no longer be able to accept these samples, but that those in need of the service are able to book an appointment through Click Santé as needed.
We shouldn't have to wait 3-4 months to get a blood test appointment to be available, or have to go to like Timbuktu to get a blood test appointment. We need to be aware that we have more regions, like the region of Montreal, that is highly populated, and we need to make sure that we attend to that population accordingly, or else it becomes unfair and it decreases the accessibility of healthcare. And we, as Quebec citizens, we deserve accessibility to healthcare.
In Montreal, Felisha Adam, City News.